So it's been 40 years since the inception of MedSTAR Transport. Over those 40 years, this program has grown and grown and grown and has become a remarkable value to the community. Back in 1983, I was the Inaugural Medical Director for the MedSTAR Transport system. And as I think about MedSTAR Transport, I always come back to its people, the dedication and the commitment and the training. The pilots, the ground crew, the maintenance crew, the communications specialists in the transfer center, and the actual clinical crew, the nurse and paramedic, who really provide advanced care through that journey.
I flew the very first mission for MedSTAR Transport, July 3rd, 1983. Flying those patients in that aircraft, they were very exciting times. And they're still exciting times. That's why I'm still doing it. We started as a one helicopter program out of Washington Hospital Center. Just a few years later, we added a second helicopter and more staffing. And then we started expanding out.
We frequently did transports directly from the scene where there was a trauma patient that needed to be flown to a level 1 trauma center. So the paramedics had particular expertise really to add to that situation.
And you take a nurse out of an ICU where they've got plenty of backup, plenty of resources. You put them in the back of a helicopter, it's a tough job. To watch that transition is a pretty cool thing.
Medical transport, both on the ground and the air medical side, really brings the best out of every clinician. And our clinicians are trained at a very high level. And they push each other to continue learning, to continue growing. And they do that because they have a high standard of care for their patients, and they want to be able to deliver that care to their community on a regular basis.
With the terrorist attack on the Pentagon, they were one of the first helicopters to land there. And even in the days following 9/11, they were the only civilian medevac program that was authorized to continue to fly missions at a time that the airspace was closed. During the COVID pandemic, we were able to distribute patients across the system so that no one entity got overloaded. That allowed MedSTAR Health to take care of 1 in 4 COVID patients in our region.
It's really valuable to be able to make such a difference during their most vulnerable times. This environment is so unique, and you just don't get to deliver the same kind of care in any other environment.
It was 4th of July, 2021, and I had a major heart attack. The hospital here in Annapolis did what they could for me, but they knew I needed more medical attention. I was taken to MedSTAR Washington Hospital Center, but I didn't get to enjoy the flight at all. I was unconscious the whole time, and I woke up the next morning, and the first question I asked, how did I get here? If it wasn't for MedSTAR Transport, I wouldn't be sitting here today. They are the unsung heroes, and when you see that yellow and blue helicopter, well, someone's lucky up there.
As we look at the history of the program and the legacy that we've built, I'm excited about the future, I'm excited about the program, and to build this culture and this legacy for the next 40 years.
Doing what we do every day, sometimes can be a challenge. But if I had the chance to do it all over again, I'd be doing the same exact thing.
And so, from all of us who have been so fortunate to take that miracle flight, we're going to say thank you, MedSTAR Transport.
And last year, MedSTAR Transport provided services to more than 6,000 patients. And of those 6,000, I am sure that there are many whose lives were saved, and there will be many more saved in the future.